Our next session will be led by Dr. Radhika Injamuri from India. She is a pediatrician with a medical doctor degree in Ayurveda as well as with a PhD diploma. She serves as an associate professor of the Ayurvedic Medical College in Karnataka. Her academic journey also includes specialized training in Yale University and from the University of Colorado system. She brings 9 years of teaching experience and 12 years of clinical practice with a strong focus on child health care. She has published 20 journal articles and presented at numerous national and international conferences. Dr. Injamuri is not online with us. Anyway, she provides us with her pre-recorded presentation. So please, let's go.
Good afternoon, everyone. Myself, Dr. Radhika Injamuri, PhD Scholar, Department of Kraumavidya, Sri Sri College of Ayurvedic Science and Research Center, Sri Sri University, Cuttack, Odisha, India. It is my privilege to present today on the topic that lies at the intersection of modern medicine and ancient wisdom. Let us begin by understanding the challenges of cognitive impairment in cerebral palsy. The title of my presentation is Enhancing Cognitive Outcomes in Cerebral Palsy, Integrating Traditional Medicine. These are the contents of my presentation, which includes introduction, material and methods, result, discussion, conclusion, and references. The introduction. Cerebral palsy is a permanent disorder related to movement and posture caused by abnormal brain development or damage to the developing brain, typically occurring before, during, or shortly after birth. The condition affects muscle control, coordination, and balance, often leading to a motor impairment and cognitive challenges. The prevalence is 4 per 1,000 live births at present. The children with cerebral palsy exhibit symptoms like visual, hearing, speech, cognitive impairment, behavioral abnormality, drooling of saliva, feeding difficulties, communication difficulties, and delayed milestones. Also, a lack of attainment of higher mental functions, which in turn lead to a burden on the families and society. Multi-system involvement in cerebral palsy makes its management symptomatic, such as speech therapy, occupational physiotherapy, medication, surgery. Apart from all, the impact over the current rehabilitation interventions are limited. This paper explores cognitive enhancement, assessing its effectiveness in promoting cognitive growth over the Ayurvedic interventions. So, what is a cognition? It comprises of mental capabilities involved in perception, memory, attention, language, problem solving, and executive functions. In cerebral palsy, this impairment is common and significantly impacts academic achievement, social integration, and overall quality of life in a child suffering with cerebral palsy. In an Ayurvedic perspective, cognition involves Dhi, which is intellect, Dhriti, retention, Smriti, memory. Imbalances of dosha affects the mana and its functions. Therapies aims at balancing these doshas and improving the intellect of the child. These are the materials and methods used for this study, which includes Panchabhautika Gritha, given in the form of nasya, that is installation of drops intranasally once in a day with a dosage of 2 drops morning on empty stomach for 30 days. And the assessment is done through maize motor free compilation. So this is how the result is being seen in the children related to the parameters, taking into the consideration of the awareness, imitation, attention, visual memory, language comprehension, and the communication. So you can see the result in a pie chart representing these different parameters, and these were being assessed on day 1, 30th day, and on the 60th day, which is a follow-up. And these are the parameters which are included in maize motor free compilation, which include social and communication subscales, language comprehension subscales, cognitive subscales. So coming to the disease, cerebral palsy can be understood as Vata Pradhana Tridoshaja Vyadhi and Shiro Marmamigata Vata Vyadhi. And Panchabhautika Grita consists of Ushnavirya Dravyas, hence Ushnavirya acts as a Kafahara. And the Madhur Rasa, which acts on the Indriya Prasadakara, means sensory organ nourishing, and it also nourishes all the doshas at cellular level and eliminates especially the Pitta dosha. Snigdha Guna, which is present in the Grita, acts as a Vatahara and it acts as a Bala Varnakara, which promotes the strength and complexion of the child. Vipaka is assessed finally after the complete metabolism of the drug, and through the final effect of the drug, Madhura Vipaka nourishes the Saptadhatu. So this is how the drug has been planned. And the contents of these drugs are having a Jeevaniya Ganadravyas, like the drugs which are having the active components in Glycyrrhizia glabra, such as glycerin and flavonoids, which are believed to contribute to its neuroprotective and cognitive enhancing effects. And also this drug like Vitis vinifera extract significantly had shown improvement in a cognitive function and has shown improvements in the memory, attention and the language skills. Added with, the preparation is done with the Grita, that is the ghee, which is a lipophilic nature of Grita, circulates the therapeutic benefits of the drugs into the cells, including the brains, as it is able to cross the blood-brain barrier. Due to samskarasya anuvartanat and yogavahi property, medicated Grita plays a potential role in delivering the drug to the brain. And coming to the mode of action of the Nasya, so the pharmacodynamics can be explained by three pathways. One is vascular pathway, neurological pathway and diffusion through the mucosa. The vascular pathway. The nasal mucosa is richly supplied with the blood vessels, particularly venous plexuses and the capillaries. The active phytochemical present in the drug gets absorbed through this vascular bed and directly enters the systemic circulation. And coming to this neurological pathway, the nasal cavity is closely associated with the cranial nerves, especially the olfactory and the trigeminal. Molecules present in the drug can reach the brain via axonal transport along the olfactory neurons. And the final path, which is a diffusion through mucosa. The nasal epithelium has a thin mucosal layer and it's highly permeable to lipophilic medications, which can diffuse across cell membranes of the mucosa and thereby reaching the lymphatic circulation. The therapy cleanses and opens the channels of the head, which is acting on kapha avarana, thereby removing the process of oxygenation, improving the oxygenation, that is pranavayu improvement happens, which has a direct influence on the functions of the brain. And as this comes as a Snehananasya and Brahmananasya, which is said as best for Vata Vyadhi, and especially Shiromarma Bigata Vata Vyadhi, which is what cerebral palsy is. Coming to the conclusion, early cognitive intervention enhances the social interaction of the child and brings the child into a emotional are thought to enhance the cognitive function through the properties of the ingredients acting as a neuroprotective, improving neurotransmittory function and enhancing the brain plasticity. This case report reflects that an early interference of therapy can revitalize the functions of sense organs, which in turn enhances cognition. Cognitive impairments can have a negative impact on motor development in cerebral palsy by affecting the ability to learn, to adapt to the different situations, and to follow the instructions or the feedback which are being given to the child to make them learn different activities. So hence cognitive impairment can also limit the exposure of diverse and stimulating experiences that can promote the motor learning and skill acquisition. Therefore, it is essential to understand the impact of cognition in relation with development in cerebral palsy. So this is how and this comes to the end of the presentation. So these are the references of the presentation. And I thank the organizers for giving me this opportunity. Thank you.
So this was Dr. Injamuri and her contribution to our program. We thank her very much.